In this video, we're going to go over some of our image receptors that we have here on campus. We have different size image receptors. The size is an 8 by 10. This cassette size is 10 by 12. We do also have 11 by 14 inch cassettes. I don't have one pulled out currently. And we also have 14 by 17 inch cassette sizes here on campus. Keep in mind that as we go over the cassette sizes throughout the procedures course, that your clinical sites may have very similar image receptor sizes, or they may have a big wireless detector or wired detector, which is only 17 inches by 17 inches. In that case, your responsibility is going to be to collimate down to the appropriate size for the part that we're imaging, and keep in mind the cassette sizes that we're using in class and lab to help you determine how big of a field of view size that you should be using. So let's take a look at the cassette just a little bit closer. I'll bring it closer so that you can see it. One thing to note is which side are you going to use to image your part. On our cassettes, it does say tube side, which means that this is the side up. This is the side that you want to put your part of interest. If you place it on the back side of the cassette and you were to actually take an exposure, you would get nothing resulting on your image. So make sure that you're orienting the cassette correctly to begin with. There are also markings on this cassette. You can see here there's an arrow and there's an arrow here. And if you were to connect those two arrows, that would be the very center of your cassette. One of your goals in procedures and positioning is to get your body part of interest in the very center of the cassette, and also to have the central ray centered to the center of the cassette as well. Next thing that I wanted to go over is cassette orientation. So when we're imaging, we need to decide how are we going to orient our cassette, whether it's on the tabletop or in the table bucky or the upright wall bucky. The most common that you'll see, there's two different names for it. So this is either portrait or lengthwise. You'll hear those two terms interchangeably. You could also orient your cassette this way, which we call landscape or crosswise. And sometimes when we're imaging a body part, such as a long bone, and we want to include both joints on one image receptor, it's not going to be possible to fit that either lengthwise or crosswise. And so then we're going to be able to use corner to corner on our cassette. And I'll show you a couple of different examples of what we mean by this. Okay, so the next thing that we'll talk about is how we're going to align our part of interest with our cassette. The main thing to keep in mind is that you want the long axis of your body part aligned with the long axis of our cassette. So the first example that I'll demonstrate is on Jen over here, and I'm going to demonstrate with your hand. So Jen, if you would put your elbow up here for me, we'll get into proper positioning shortly. So starting with the hand, when we're imaging the hand, you can see that the long axis of the hand goes from her fingertip down to her wrist. The long axis of the cassette in this situation is opposite. So the long axis of the cassette is this way. So the better way to have this image obtained is to turn the cassette so that the long axis of the cassette is going to match the long axis of the body part. The next example that we'll look at is Jen's forearm. So Jen, if you would just extend your arm with your palm up. So if I were to place this cassette underneath of her forearm, we are looking at the long bones in her arm. I want to make sure that I'm including both joints on this projection. So we're close to fitting this. I would think that we would manage to get both joints on this image. However, you'll notice that the long axis of her arm is not aligned with the long axis of the cassette. So it's better if she'll lift up her arm to turn this cassette so that the long axis of the cassette is aligned with the long axis of her arm. And the other thing that you'll notice is that I'm trying to get the midpoint of her body part aligned to the midpoint of my cassette in both directions. So I want the middle of her forearm here and the middle of her arm aligned with the middle of the cassette as well. The next example that we'll look at is the tibia fibula or tib-fib. Most of your patients, you'll notice that their lower leg is not going to fit on the cassette to include both the knee and ankle joints if you orient the cassette portrait. So another way that you can use the cassette alignment would be to turn the cassette so that now the long axis of the part is aligned corner to corner. That way you get both joints and the entire long bone on one image receptor. So in conclusion, some things to keep in mind. Your goal is to always get the body part of interest as close to the image receptor as possible. You also want to use the smallest image receptor possible for the body part that you are imaging. So for instance, even though I have a 14 by 17 cassette available, If we're looking at a hand x-ray, you can see that that image receptor is much too big for the body part that I'm imaging. Yeah. So you can see then that a better cassette size to use for something like a hand x-ray would be a 10 by 12. Now again, in lab we do have an 8 by 10 cassette. However, you'll see that in lab you're going to predominantly use the 10 by 12 and the 14 by 17 cassette sizes because that is what is mostly available to you in the clinical setting. The other thing that students can struggle with is making sure that the body part is centered to the center of your cassette. So again, you want to be sure that your part of interest is directly in the center of your cassette instead of off-centered when you're lining up your central ray. Now in clinical, again, you may see where that's not as important to have it centered to the center if you have a direct digital receptor. However, we're using CR detectors here on campus, and so your goal should be to have the center of your body part to the center of your cassette every time. For a moment, we're going to imagine that this is our 17-inch by 17-inch direct digital receptor that you may see in your clinical setting. Now again, this is 14 by 17, but it's the closest that I have. If this were the only size detector that were available, obviously you're going to have to use it. The important thing, however, would be to remember that we're telling you that your field of view should be no bigger than, say, an 8 by 10, and so then you would want to collimate down to an 8 by 10 field of view surrounding your body part rather than leaving your collimation open to a full 17 by 17 inches.